Namaskar, Sat Sri Akal, Adab, and a very warm welcome to everyone here at Motherhood Club. I am Ekta Sehgal, founder and chief strategy officer, Motherhood Club. Motherhood Club has been working extensively on three pillars: health, wealth, and happiness, because we feel whichever way you bring them in your life, it eventually leads to you having a life which is filled with purpose, which is filled with contentment, and you are able to achieve all that you wish to. After all, if you have good health, you will be able to work, create wealth for yourself. If you create wealth and you have the good health, happiness is there, because without being happy in life, I don't think one can ever achieve anything. Turn it around, look at it whichever way. It is a beautiful line that is important in our life, with, of course, the ups and downs, because that's what makes it more interesting. We all know what a straight line really means. Why am I giving you this background? Because what we are going to be talking about today is something related to our health. Motherhood Club last year in September started their first ever donation drive, where we chose sanitary pad distribution to women and girls from humble background, because we felt that if we need to drive a point home about education, about women being financially independent, women being confident and walking outside their homes with dignity, all this can happen. But if we tell them directly, perhaps they may say that we already know this. Why are you telling us? But think about all those women who stay in places where even basic hygiene is compromised. Do you think they have the wherewithal to actually focus upon their internal hygiene? Well, you will be surprised to know that in many places, be it rural, be it the smaller cities, women in the humble background are yet to be exposed to something as basic or as important a thing as a sanitary napkin. They still use dirty cloth or many other things during those 5 days of their menstrual cycle, which you and I cannot even imagine. We've been running these drives for the last 1 year now, and across 8 cities. We've been talking about personal hygiene when we go and meet these ladies, these girls, and tell them about this. But it is also important that these conversations don't just happen with women who are from humble background, but for women like you and me and all women across the world. It is important for each one of us to understand how should we take care of ourselves, not only during those 5 days but otherwise, but specifically during those 5 days, because those 5 days are not just 5 days. Just multiply it by at least 35 to 40 years of your life. That's the number of days that we are talking about, because a human body, on the least, has that many years. I mean, the human body of a woman has that many years of the menstrual cycle that one a lady or a girl goes through. You have it, it's a problem. You don't have it, it for sure is a problem. But when you have it, you need to maintain your hygiene. And because of this very reason, today with us is Dr. Kanchan Singh. She's the state president for Sanitary and Hygiene Council from WICCI. And what else should I say about Dr. Kanchan? Though she's a dermatologist, a cosmetologist with over 12 years of experience, but what she realized in her journey is that yes, we need to look beautiful. Our skin should look glowing and healthy. But at the same time, if we are not healthy within, we are not healthy, period. There is no further conversation to that. It's not just always about looking good or looking healthy, it is also about feeling good and feeling healthy. And menstrual hygiene is an integral part of that. Dr. Kanchan has many accolades to her credit, and I am grateful to Piyusha from Balika Vidya who connected us. And we've been having some meaningful conversation for the last few weeks, or rather months, I would say, where we've been talking about that it is imperative for each one of us to know that the sanitary napkins that we are using, are they really good for us? Are they friendly towards our body? So, very warm welcome, Dr. Kanchan. I hope you're doing great.
Thank you so much, Ektaji, for such a precise, introduction and such a warm gesture from your end. I'm really grateful to you and the entire Motherhood Club for coming forward and taking up this crucial topic to your audience and giving me a platform, yet another platform to address the people from here. Yes, absolutely doing good, and I am very glad to be part of this conversation, the talk show that you're organizing today.
Thank you. Thank you so much for your kind words, Dr. Kanchan. I've introduced you very briefly, and as I always tell my guests, that reading a profile verbatim is not something that I feel is the most appropriate way to introduce anyone, because our profiles could vary from 20, 30, 40 words to maybe 5 pages. But I think what is important is that what you do, that you're the most passionate about, if you tell us about it, it has a far deeper impact. Otherwise, the profile definitely has been shared with all our members at the Motherhood Club. So we'd like to hear a little more about you, as to, you know,
Definitely.
who you are and what brought you to start working on the hygiene of women, the internal hygiene of women.
Absolutely. And I will be glad to share my journey with the audience here. So, to give my precise introduction, I'm Dr. Kanchan Singh. I'm based out at Gurgaon currently. And by profession, I'm a doctor. Post, I did my medical graduation. I did MBA in marketing. So, I've been a person who is both into medical and marketing for working for pharmaceutical and healthcare industry precisely for 12 years now. Out of my vivid experience of 12 years, I have been assigned as a clinical trainer to dermatologists and cosmetologists. I was dealing with cosmetic lasers for international brands, where I have been training the doctors on these lasers. While I was training the doctors on this laser, yes, we have always been more focused on the external beauty, how you appear, how you look. But definitely what we all as an individual know, that apart from external beauty, what really matters in your today's life, how beautiful you are deep within inside, and how pure you are in terms like the inner beauty, the mental health, the disease condition, are you free from all diseases, which is what really matters. Apart from that, background wise, I have been born to a family of doctor, where my father and my elder brother has been doctor. And I was the third one in the family from the medical background. We were a very close knit nuclear family, where we were only four members in the family, the fourth one being my mother, who was truly a homemaker. And it gives me immense pain when I say that, within a family of four people with three a doctor, we were raising a silent cancer victim. My mother got diagnosed at a very early age, at just age of 48, with cancer. And while she got diagnosed, she was already in stage third. We had no clue. Absolutely, she was doing fine. She had no symptoms, no features of any kind of pain there. And then suddenly we realized the doctor coming up and telling us she already have developed breast cancer, which is confined to one breast. By the time, that time we were located at Kolkata, and remotely all the medical interventions or the test which is being needed in the due course used to be from Mumbai or from other cities. So we have to send the reports or the samples for definitely to Mumbai, Tata Memorial or other hospital. In the process, we exhausted few days, and by the time we used to get the report, we used to hear that it have already started spreading, and it is getting into other organs. This process continued for precisely 3 to 4 weeks, while we were like conducting all the tests to know that what is the feasibility of getting her operated for that particular organ. But then doctor turned up after that it had become already metastatic, and there is no scope of getting her operated. The journey become even worse then, because we have to put her on chemo for almost a time of 3.5 year. And I really have to tell you that what I am today, I am a strong lady seeing her journey of cancer, the fight that she have given her. And I realized that over the 3.5 years time, when I was nursing my mother in this critical stage, I realized the cancer is too big for an individual to handle, because it is not only affecting the individual, but it is affecting you physically, mentally, emotionally, socially, everywhere it is impacting an individual, plus the entire family who's associated, the friend, the family, the caregivers, everybody is in too much pain and agony. And yes, what happens in most of the cases, we lost her. She couldn't, sustain more than a certain set of chemo, and the battle was soon over. I was very young. I was not even married that time. I was just pursuing my career, a fresher in the industry, and I really wanted to do and pay back to society, do something in the field of cancer. I started approaching a lot many people, the NGOs, the caregivers, the doctors, saying that I really want to make a difference and do something in terms of serving the cancer patient. They initially mocked at me and they laughed that you are too young to understand the kind of magnanimity the cancer have. You can't even imagine how the cancer is so big that one is not enough to do anything about it. I was just wondering what could I do when it came to serving the cancer patient. I realized every cancer patient have to go for chemo weekly, twice or thrice, which consumes almost around 10 hours in a week. And for a person who is on a work or doing any sort of business, it is not possible to do at that moment. So I realized I won't be able to. And when I think about donating something out of my earnings, I realize whatever you are earning, it is very very meager amount when you try to contribute, because each of the chemotherapy would cost roughly around 50,000, and weekly people end up spending lakhs, which is too enormous for a distribution. And that is a time when I really realize, if anything that I could have ever done in terms of working towards cancer is creating awareness. Since I was also almost hand to mouth earning in a new job, a new career, and everything is traveling with that, I realized that I only thing that I could ever do is awareness. So I started stepping toward it. But then yes, I was struggling, and it took me enough years to actually make that considerate feed that kya karna hai. I was preparing from deep within. The system continued. I started working in pharmaceutical and healthcare industry. I was my niche have been dermatology and cosmetology. So 12 year, out of this 6 year labs during that. But then when the COVID pandemic came, it really gave all of us an opportunity while we were sitting back home and working from home, and most of the work were at stop. I started doing my R&D, that what should I do now. Somewhat I'm stable, somewhat I'm more knowledgeable than what I was in the earlier days. Somewhat I'm more resourceful in terms of people like you whom I have connected over the time. Then I thought it is the right time. And that is how, apart from my own niche of dermatology and cosmetology, I entered into the field of menstrual hygiene. One reason to take up the cervix cancer or uterine cancer being the specific announcement from WHO, which says that it's been one of the largest factor of female dying all over the globe. Almost like every 8 minutes one female dies of cervix cancer. And then I realized, yes, this is definitely something I would like to work on, and the journey kick started.
Okay, I'm just trying to absorb all that you said because sometimes when we talk professionally, we end up talking only about work, and we never get into the you never get into the skin of the other person to understand what one goes through. And you're very right in saying, Kanchan, I'm going to call you Kanchan. Dr. Kanchan is
Yes,
too.
sure.
That you know, I think the adversities in our life always gives us a purpose in life. You know, Perhaps had your mom not been through what she did, maybe you would have continued to be a dermatologist or a cosmetologist, and just work on the external beauty of the women, or even men for that matter, because these days even men do visit dermatologist. uh, and I think you've chosen the right path, because the moment you start educating people, you can only support someone financially once, twice, or maybe depending upon how much God has been kind to you, that you can give that resource, which is the monetary resource. But the education resource is something that always stays with people. And that's something that really resonates with us at Motherhood Club also, because in addition to sanitary pad drive, we also took up cancer as a topic, or as a mission, to say so, to create awareness, to talk about it. So we did a couple of sessions with one of the leading oncologists, radiation oncologist, Dr. Indu Bansal, who's from Narayana Hospital, Gurgaon, so that people should be aware, be it men or women. The ailment doesn't look at your gender and come to you. And what you said is absolutely right, that cervix cancer, even in today's time, is one of the worst hit when it comes to any one of us. And this is after the fact that there is a vaccination available, which many people avoid. And the vaccination can be given to Someone as young as 10 years, 11 years, girls can be given this vaccination, or you can even take this vaccination at a later point in time. But that awareness is a miss. But today we are talking about two things. We're talking about menstrual hygiene, we're talking about cancer, preventing cancer. How do these two things come together? So, do I derive that bad menstrual hygiene is one of the major reasons that could lead to the uterine or the cervix cancer? Or am I wrong in understanding that?
So definitely, you have raised a very valid question, Ekta, which would actually bring a lot of light on the topic for all the viewers who are associated with us right now. Since I said that, if we see a global scenario, there are two common cancer which are found in female. The largest being the breast cancer, for which a lot of awareness event episodes being taken from government and from the other social bodies, also from the NGOs and everybody who are trying to come forward and tell that you have to get your mammography and certain tests done on a regular basis, if you have any sort of precursors which could lead you to cancer. The second set of cancer, which is cervix cancer, is also in a raising incidence, like, well, while I said every 8 minute loss of a life globally. Out of the entire globe, Asia being the biggest contributor in the entire scenario. And if we consider Asia, India being the highest contributor. So overall, you can say India have been monitored very closely by WHO on this particular ground. Because today, whether we admit or not, there are millions of cases which goes unidentified, which goes undiagnosed, which goes without treatment, and they die, and then we get to know whether she was suffering from something, and she would have never got a chance to reach out to a doctor or caregiver. She have not even gone through a screening. And there are millions of life apart from that also, India being the biggest contributor. So we do realize that it is a alarming threat that we have to address. And there is no better way than raising the consciousness or raising the awareness among the female, that what could be those few symptoms that if you see, you have to reach out to your doctors, may it be anyone. You have to talk to people on that, are you are facing it. Now when you say menstrual hygiene and cancer, yes, it is very closely related. And I was, being a doctor also, I would say that I was very shocked to know the details of it, while it came very handy to me from certain authorities, certain gynecologists, certain medical professionals who are dealing exclusively with the cancer. And when we talk about cervix cancer, there are many reasons. Like for instance, if I quote you couple of reasons for cervix cancer, one is a female who has been affected with HPV or HIV infection is a very prone to developing a cancer in the later stage of the life. A female who have multiple full-term deliveries, because when you have full-term deliveries or you given a normal passage delivery, couple of multiple deliveries, your cervix is dilated, it is more eroded, and you have a higher chance of developing a cancer. Also, the cancer chances have been seen more alarming in the female who get aborted somewhat or get into abortion purposefully. Either you have lost the baby, you have you have abortion somewhat which happened naturally, or if you're getting into abortion, this is also something very alarming. But there are, apart from this also, smoking and having multiple sex partners, and there are many other reasons associated to it. But what really came as shocking to me was that the napkins, the sanitary pads that we use for our sanitary hygiene in those the red days, is also a reason to cancer. And I was just wondering, what if it is a reason to cancer? Do we have a chance to avoid it or not using it? I guess no. Because if I'm on a period or you are on a period, I guess we can still afford to have neglect our food or drinks or maybe sleep, but we do not have chance to avoid our sanitary pad. It has been so essential for all of us. And when we talk about the incidences which you really highlighted in the beginning only, it is not about those 5 days. It is 5 days multiplied by 12 months, multiplied by 35 or 40 odd years in our life, which is enormous time of our lifetime. And while we talk about this sanitary pad, Ekta, we have been, talking about a module where we raise awareness among the young girls, the females, that sanitary. When we talk about sanitary hygiene, it is not just 5 days, because it is not about the flow or protecting the flow coming out, but it is also about how females could prevent from infertility, how females could handle the gynecological issues like rashes and white discharge, or the itching problem which happens during the periods. And sometimes it is also to deal with cancer is an end result. So while we say cancer, it is something which will happen over a time of 10 to 15 years. But what goes in a process is the itching, rashes, white discharge, cyst, infertility, and much more. The reproductive tract infection, the urinary tract infection, which we every alternate day we get to hear, but people are just ignoring it because they think it's okay, chalta hai, koi baat nahi hai. It is just for 2 days here. So these all precursor is what we end up missing, and the silently the cancer start breeding into our body. So that's what I said. It is not only about the inner health. It is also about the. It is not about the outer health or the outer beauty. It is also about the inner health, which we try to neglect, and that is how we come up in the picture. And while I started with the whole concept, I was actually fumbling. I was thinking, whom do I reach out and who would hear? Because I have been into dermatology, cosmetology, and I have never been into menstrual hygiene. But yes, I thank the almighty for giving me excellent resources, for the platform like WICCI, for people like you who runs the exclusive female community from the Motherhood Club, or many other divine resources who let me over the time, over almost 1 year, to reach out almost to lakhs of females. And I'm very glad about that part, that when people get to know how serious is the topic, they actually extend the helping hand, that Kanchan, let me allow you to reach out to more number of female, and the journey continues. So definitely
Absolutely.
I would like to share more on this particular thing.
Absolutely, you're very right. I think uh, it's not just about you and me over here. It's about the legacy that is going to follow, right? Our grandmothers, our mothers perhaps have passed that phase, but you look at the women around us. We are all a victim of it. These are problems, these are issues that you have spelled out, which everybody goes through. And but everybody, they just kind of it's like a taboo to talk about all these things. It's a very hush hush thing that, oh, we cannot discuss
Correct.
this. Nobody should get to know in the house that all these things are happening, and so on and so forth. But so I think it's very important, and you are absolutely on the right mission, I would say, that create awareness as a first step and talk about it, because the more people you reach out to, the more awareness will be created. uh, Eli is saying that your talk is a sort of revolution. Absolutely. There are, and thank you everyone who
Thank you
have
so much.
joined us, who are watching us right now on Facebook and YouTube, and who would be watching this conversation at a later point in time. Most of you are women. There are a few men also who are watching us. It's a humble request that if you think that what we are talking here is of relevance, which I'm sure is, because each of us have women in our house, please do share this with them. You could share it on your timelines, or you could even share the link from our YouTube channel, which is also by the name of Motherhood Club. Kanchan, before we go further, there was a question that had come in the beginning. I think,
Yes, sure.
yeah, so that was from Sugar Jones. She's asking that I want to know how much is normal to bleed. If you would like to
How much
address
is
this before we, how much is normal to bleed?
normal to blend? Yes. So this. Thank you, Sugar Jones, for coming up with the question. And yes, of course, Ekta ji, I'm not able to see the question of viewers, so I would really want you, whenever the question comes, let me know on this. So,
Sure.
Sugar Jones, if I have to address on the normal bleeding, according to the WHO or Indian Medical Association, this is quite individualistic approach. Every female have their own unique body and have their own flow. So, if I take as an average consideration, normal bleeding range from 20 ml a day. So if I really have to show you, so this is a 25 ml syringe. So you can just estimate a normal bleeding starts from this syringe, 20 ml a day, and it could go maximum to almost around 80 ml a day. So one female end up bleeding this much in a day, and this is quite normal. So when we say 20 to 80 ml, you might be wondering, how come this much of blood, and why don't I see? So your menstrual blood is just not the menstrual blood that you happen to see on your pad. So whenever you go to pee, you have huge hush of blood which is coming out after the urination, the clots and everything is being counted. Anything between a range of 20 ml to 80 ml is a normal. If we consider an average situation, this is 50 to 65 ml average that we bleed. Now coming to the number of days, many a female have complaints that doctor, I bleed only for 2 days and I'm not getting big flow, and somebody bleeds for 5 days, they are very fertile. Nothing like that. I would like to break this myth that bleeding between 2 days to 7 days is very normal pattern. So if you're bleeding for 2 days, it is quite a healthy uterus sign. If you're bleeding 7 days, it is still normal, nothing to worry. But if you are exceeding the limit of 7 days, you must ask your gynecologist, because you can consider bleeding 7 days, 50 ml a day. It is almost a situation of anemia for you, and that is why we ask you to go to the doctor. So this is what, and I believe everybody keeps a watch on their menstrual calendar. When you are bleeding, what are those 5 days of your thing? Because for all the vital identification, for all the vital analysis, whenever you go to a gynecologist or a pathology center, that is the first question: what was your last menstrual day? So girls, keep a track of your last menstrual day, because it is a very very vital factor for all diagnosis in this matter.
Absolutely. So, I think that leads, thank you, Sugar Jones, for your question. And I think that leads me to my next question. You mentioned about all the challenges that a lady goes through during those 5 days, 5 into 12 into 35 into 40, whatever the number of years it is for each of us. There are a lot of products that are available in the market and which vary in terms of the pattern, the thickness of the product that is available. The Each of them says high absorbent, and you can use it all day, 24 hours, overnight, and so on and so forth. There are a lot of tall claims that are there, without naming any brand in particular. And then of course different pricing is also available for different brands depending upon the branding that is there. Are these napkins really body friendly, or what kind of napkins are actually body friendly, and how can we know that? If you could throw some light on this.
Absolutely. So again, a very important factor that you have to figure out when you are considering your, hygiene parameters or the safety parameters for your red days. So when we talk about, various protection methodology available, worldwide, if we say there are primarily three categories. One being the pads, the sanitary pads, which have been widely accepted, and you can say out of all users, it counts to almost 95 plus percentage of the users. Then there are latest, sustainable solution which came in place, like menstrual cups, which is almost like lesser than a 5% globally, and there have been immense reason for not kicking success at the first place for this. And one protection measure is tampons, which is having a lot of limitations and very rarely accepted amongst the crowd. When we talk about the pads, जैसे आपने बोला ना, right now you say that the thickness, the kind of absorption, and pads have a tall claims. So what goes inside? So basically, the pads are meant for the protections, and we must see the reason of using a pad, that we don't want that the flow to come out and stain our dresses, or neither to stick to our body, because anyways the blood is pure, but once it is being it exits from your body and comes in contact of the air, or your undergarments or anything, it gets polluted, and it have own tendency of causing you some kind of a problem, even with a stain that is in your panties. So pads been widely been used. There are two categories of pad. One are which are reusable pads. So you have a wide options of reusable pad, which we call as a cotton pad, which is as good as the cloth that we used to use almost 2-3 decades ago, while we started on this journey. And the other option is a disposable pad, which you use and throw. Now coming to a disposable pad, it really kicked in the market and have widely been accepted amongst the crowd, mostly with the young crowd, because yes, it is very sterile, it is very handy to use. Once you use, after a couple of hours you throw and place the other one. So that become the most widely accepted choice among the young girls. But what we missed about this particular pad is what it is made of. Now looking into the scenario in 1998, when India actually launched the pad through some pad man, when the entire revolution come in place, that you have to switch from the cotton, cloth to a pad, and you have that basic rights in place. Handful a number of females, only probably some thousands of females were using that pad. But if we consider today's scenario in 2022, you have more than 15-20 crores of female using it every day. So the scenario have really changed, and yes, the industry and everybody have to raise its scalability. So what came very handy to support the entire mass was the plastic pads. Now whatever pads that you use, commercial brands that is available, unfortunately they are made of plastics. And when we talk about plastic comes a lot of health concern, because we know it is neither good for environment nor for health. And we always keep on saying, don't carry things on plastic, don't use the plastic utensils, don't use the plastic things, because we know how hazardous it is if we consume. So if you consume orally, or if you use it, probably the local thing, if you just in touch of the plastic also, the hazards are enormous. So yes, while you are talking about a pad, there is a certain thing that we are going to highlight and exchange information to the people who are watching this, about what set of pads need to be used, and what is called as skin friendly or health friendly or eco friendly pads. So we will come to that in a detailed thing as well.
Right. So I think a lot of awareness is coming in people. People are getting conscious also about looking at these biodegradable napkins, so that that's more environment friendly. And as you said also, that if you look at the percentage of people using the menstrual cup, perhaps there is a lot of inertia for multiple reasons with that, and not many people are still conversant with regards to the menstrual cups. So now let's jump to this, that what kind of napkins should one use, right?
Okay.
What is the ideal change time? But before you answer that, there is a question that has come from our viewer, from Ila, that can a woman get cervix cancer after few years of menopause? Is that possible?
Yes, it is possible. Depends what age the female have got the cancer. So now menopause, when we talk about, there is no ideal age for it. So you sometimes it happens that you start very early on the menstrual journey, and you have the pause very early in your life. Some female comes even at the age of 35 and 40, saying that we got the menopause well in place. And yes, of course, we know there would have been enormous underlying factor, but what we have to count is what is her age. So normally when we talk about cervix cancer screening, in this scenario, government have come up with a 5-year guideline. So cervix cancer screening are ideally done by pap smear test. And the government recommend every female must go this test once in a 5 year. Because yes, you don't have to initiate was 3 years, but then government wanted to reduce the number of scam, because looking into the affordability, and also the cancer have a significant time to overgrow of a certain extent. Only time that the government asks you to stop on this particular scan is when you are 65 or above. Now, starting from a very early age to 65, you have the chances of developing a cancer. Once you 65 and above, already on menstrual menopause, and with other things in the place, we do realize there are very sleek chances of having it. And that is how we stop. So anytime between starting from your menstrual menarche to age of 65, it is a possible thing. And yes, it will not happen at that age. The precursor would have started 15, 20 years already sooner in your life. It is just what exhibits as a symptoms.
Absolutely. And I think one is always at a risk of getting the HPV virus till the time one is sexually active,
Yes,
because
yes,
that is
correct.
one way of having that virus inside your body. And so, yes, I think what is important is that women across the age, from the time you attain your puberty till you are at least till 65, 70, or
60,
even later on
65
also, I
years.
would say, one needs to maintain the personal hygiene. One needs to be careful. One needs to get oneself test. Talking about the pap smear, it was 3 years, now it's 5. We've raised this point with many of you, even when we were talking about a detailed conversation on cervix cancer. We even ran a few days camp in that, have you done your pap smear? We know many of you may not be doing this, but it's a request, it's an urge. Don't wait for the last minute. Don't wait for things to actually come up and haunt you. As Kanchan was sharing her mom's journey, and that's, there are many other cancer warriors who have come here, shared their journey. We, Kanchan, we in fact are also supporting one cancer patient for her treatment. Though she didn't get cervix, she got breast cancer. We are supporting her, but the amount of pain that she goes through, the amount of
Absolutely.
pain that the entire family goes through, the
It
financial
is
intoxication
unmatched.
that it
Yeah.
goes through. It is, you can't even think about it.
Correct. Ektaji, I would just like to add on this what Ela actually asked. One is being sexually active or attaining a stage of menopause. But the other factor that I would really ask, when we go and visit the audience and make them aware, they find these tests are unnecessary. You end up investing a lot of money and nothing come out of it. It is a happy thing if nothing come out of these results. Trust me, that is the most worthy thing that you can ever attain. But I tell you, many times we overlook on certain symptoms. Like we come across females who have white discharge happening for almost 2 years down the line, and they just think it is normal part of their physiology. It is white discharge is okay. We have learned living it. It doesn't bother you much because you probably would have compromised with your hygiene factor. Apart from this, the pattern of the cycles getting disturbed. Some females come up and say they have a very erratic pattern. Sometimes the flow is within 15 days, sometimes the flow remains for 2 days, sometimes it is for 7 days, and sometimes they don't even know that in a month they are getting two periods because the cycle have really reduced. These are kind of precaution and much more. When we discuss on this is a very common thing which we all as a female are have would have evidenced. These are the precursor which tell you that there is something wrong. Either a hormonal imbalance, either something with the anatomy of the organ with some challenges which is happening. And when you facing this, getting into a 5 yearly scan is something very nominal one would have asked for. So I guess this is a very mandate for all the category. And now the government, since the incidents have been raising and alarming, government have dropped down the prices of this test. There are many free centers offering it. There are many NGOs and clubs like your own club who are tying up with bodies who could make this very affordable for people in need. So I guess there are ways out. We need to measure this and we need to make sure this have become a part of our routine. Every 5 yearly we must go if we really want to beat cancer in any ways.
True, I agree with you. So, would you like to tell us about the kind of napkins that one should actually be using, or
Absolutely.
products that are available? You mentioned that when these products were introduced, they were plastic based. Here, we are saying no to plastic in any and every form. And if plastic is touching our body, and especially the internal body parts, I'm sure we all do realize that we are all at risk. So, what is the solution, or is there a solution? How should we be more aware about this? If you could throw some light on this.
Definitely. Ekta ji, I would really seek your permission to, show a demo to people who are using a pad. Because if I say probably a half of the message would be convert, but I really want the females who are using a menstrual cup for almost, 2 to 3 decades and getting all this in place, all the challenges, and they never knew what are the real concerns. I really want them to see a real demo that what your pad contains and how it affects your, gynecological journey. So I would like to throw this with a part of demo. And yes,
Sure.
I have a demo set ready here which I would like to. So I'm just putting the camera focus onto the demo. And here what we are going to do, let me know if this is clear to you. This is
Yes.
visible?
Yeah.
Yes. So we have two set of pads which are ideally used in market, and I would really urge all the audience to have a focus on this. Now, normally what happens, no matter whatever pads you take from market, it could be any commercial brand that you have been using, as per your choice. So when once you open this pad, once you open this particular pad, you see that there is no provision of resealing it or closing it to tightly. So what happens as a result, most of the time when we are done with our 28 days of cycle, we try to keep this in cupboard, washroom, in our purses, wherever nobody can watch it very really. And we don't even think on the kind of hygiene that these places have. Washroom, one of the most moisturized area. And yes, of course you have microbacteria there in purses, even in cupboards the same thing happens. So what happens normally when we take out a pad like this from this particular tray, so I would like to show you the packing of this pad. What happens with the commercial brand of a pack, it is just for a namesake, it is closed. So if you see, I can easily insert my finger here, and this shows that if I can easily insert my finger here, there is a high chances where microbacterial manifestation have already happened. What I did as an example, I have kept one extra large size of napkin here on this tray, and we consider this one of the girls is going to use this brand which are usually available in the market and we have been practicing for a longer time. Since I told the average bleeding somewhat ranges from 50 to 65 ml, I'm just taking 50 ml of water. Yes, one disclaimer at this place is water is very different from the blood that we bleed, because it is very thin and it doesn't contain mucus like the blood. So the blood would be more viscous, the blood will contain more of a mucus and even the live bacteria onto it. So here, this is one typical brand which we use, and in the same context, what I have done as a evaluation factor, I have taken up a organic brand. Now this brand here, I have picked up a brand called Aries. For Aries, we have been actually, globally running a campaign called Save Female from Silent Killers, and I'm very glad to mention that I am one of the consultant who is doing the awareness campaign for them globally. So this is Aries brand which come up with the organic pad. Here the entire pack is made of aluminum foil, which is a food grade material, and we eliminated plastic. If we see, we can reseal this pack, but eventually if female forgets to reseal, we know the inner pack are very tightly sealed. So if you see this part, you will find that it is totally vacuum pressed. Now I
Kanchan,
have,
one second.
yes,
I'm going to exit the stream so that you're completely visible the demo. And once your demo
okay,
is over, I'm going to join back in so that people can see it clearly.
absolutely.
Yeah.
And thank you so much, Ekta ji, for such a great support, throughout. So here we are coming up with 50 ml on each side. Now let quickly taking onto the menstrual journey. This is, if the flow varies, so every female have their own definite flow. So if I consider with the bleeding starts like this, in a couple of hours we would be menstruating almost like 20-30 ml. So here I have mixed color so that it is more visible onto your screen. This actually completes 25 ml of fluid onto this pad. The same situation on the other side. So I'm pouring in another 25 ml here onto the organic pad Aries. On both sides it is been equal. So here what we do, since this is on the tray and the female while using it would be sitting and putting the body exertion, I will just show within a nominal, minimal of uses. You will see when I am rolling on the tissue paper here, you will find the wetness already coming in place. You can see the color stain and the wetness, and this is what happens with the ladies. Now all the females, even if the young girls, and even if we consider, working females, we have to go out, and it is very evident that within we are always bothered about on those red days. We are very much bothered about this wetness, because we know if we don't change pad very frequently, we would end up staining our clothes, and sometimes, we know that if it is too wet, we will end up with the itching, rashes, and all the gynecological concern. So this is a time when the females start bothering. And as Ekta ji mentioned right at the beginning, that those 5 days, all the females are in a very compromised health state and mental state, because they feel, oh, now this problem have set in, the now I have to handle, I have to focus more on handling myself, my body, and my flow, rather than any work. So every month, 5 days in a year, almost around 70-80 days, and you end up compromising overall, your competency. So this is one major challenge. Now when we talk about this sanitary pad, there could be many reasons that you are not able to change the sanitary pad quickly in a 3 to 4 hour span. Probably you sitting in a meeting like me, or probably you are working and have a group meeting to perform, you have a review meeting, you are working in the field, or even if you're a housewife who's preparing lunch and dinner for the family, may it be whatever reason, there is high chance that we don't end up changing the pad so frequently. And what happens, the bleeding continues. So little more bleeding will happen. And now if you see, even if I have only exhausted 35 ml, we know how wet it is. Oh, I can't even manage to put this napkin on the plates. So I know that I have to change. Many times we are traveling and we do not have a safe and hygienic place to change. What happens as a result? With this wetness, you are bound to develop a bacterial infection there. And this is all because the make of the plastic. So I'm just keeping this syringe here, and what I am doing on the other place, I'm just pouring in another 25 ml of liquid here. So when we consider 50 ml of a flow, it is almost like as good as a full day of flow. Yes, of course, we want females to change, but we are showing what is differential between two pads. So when we talk about this particular pad, I have poured in, 50 ml of fluid. I'm taking a tissue paper here and just pressing it over. So when I pressed it over, you can see here that this napkin is completely dry and don't even have the red color stain on it. What happened is complete absorption of the fluid. But yes, we are not here to highlight just absorption. We want to highlight how this, better absorption helps you in preventing your gynecological concern. So I'm keeping the organic pad aside right now, and I would be focusing more on the commercial brand that we have been using for ages now. Quickly unfolding the layers of this pad, you will see the commercial brand have 4 layers onto it. So whichever brand you are using at the home, I would insist all the young girls to probably invest into one of the sanitary power pad from your pocket and see this reality of the pad. So what I will do, I'll let this entire gel, I'll put in more fluid which was remaining with me so that the gel have maximum absorption and it inflates. So I'm just keeping it here, and now I'm opening up the layer. So when I open up the first layer of this particular organic commercial brand, you would be shocked to see the content that it is made up of. So here is my first layer, which is made of plastic. So if you closely see this, I hope this is quite visible with you. This is made of plastic. All the heat rashes, all the itching, all that acne kind of sort of things which we call as cellulitis, which happens during your menstrual journey on your private area on the vulva, is a result of this plastic. Plastics, being bad conductor of heat, lead you to itching, rashes, and all other problem. So this is a plastic, and this is very coarse in nature. So what happens when you put the pads in place, the friction happens between the thighs to pad, and you end up getting those bad rashes which leads you to further infection. Coming on to the second layer, you have a thin piece of paper here where you find a beautiful design onto it, probably of a sky blue color, which you can see. Now when we talk about any color, of course we know that quite a good amount of dye or chemical have been used. So this chemical being declared, this chemical is named as dioxin. So we spell it as dioxin. Dioxin are one of the most carcinogenic factor. This is a element which will lead you to cancer. So ये WHO ने already declare किया हुआ है कि अगर आपके पैड्स में डायोक्सिन जैसे chemicals हैं, it leads you to certain sort of cancer. होता कैसे है? Probably जब हम bleed करते हैं, when we start bleeding, the fluid gets inside, and this is completely wet. So if I have to really show you, see, now in this case, this is just the water that we poured in, but normally it is our menstrual blood. जैसे ही menstrual blood इसमें जाता है, the dioxin start releasing, ये धीरे धीरे discharge होना शुरू होता है, and it sticks onto the outer surface of your private area, which we call vulva. वहाँ से absorption होते होते ये nearest organ, जो जिसको हम कहते हैं cervix, जो कि uterus का faggot होता है, वहाँ तक पहुँचता है and deposit होना शुरू होता है. Now yes, you would be wondering कि doc, this is a very meager amount of color which will be used, but the question is कि वो लड़की 10 साल की उम्र से ब्लीड करना शुरू करती है, और 10 साल से आज उसकी चाहे जो भी उम्र हो, चाहे वो 35 की हो, चाहे वो 24 की हो, चाहे वो 40 की हो, आज वो कई सालों से कई हजार पैड इस्तेमाल कर चुकी होंगी. So this actually is a lethal thing which is being in place. Dioxin is a carcinogenic element and we must exclude it from our regular use. Coming on to this third layer, यहाँ पे एक cotton है. The red color is because of the color that I mix. Usually it is white, and it is very white actually in texture, because a lot of bleaching agents goes into place. Almost like 7 से 8 layer bleaching करके इसको सफेद कलर दिया जाता है. When we extract this gel, बच्चों के डाइपर्स में जेल हमें पता होता है, so वैसे ही हमारे पैड्स में भी जेल है. So if I extract this gel onto one side, we will find so the cotton and the gel is coming out together because it is too wet to handle. But yes, of course, I would like to extract it yet to show you a reality. So I'm just keeping this aside. Almost like, the cotton and the gel is out from here, and you have this thing which is completely wet. And this is the kind of, gel which you find here. These are synthetic gel manufactured in the company. Again, it contains a lot of chemicals onto it. The last layer. A very harsh reality, which I truly believe, is not known to many of us who have been using the pads for ages altogether. The last layer, which is comprised of, which is purely made of plastic. So if you see this plastic, a layer of plastic, a single use plastic, which is very hazardous to health, don't even have a single perforation. इसमें एक भी छेद नहीं है which would allow you to breathe. So when we talk about the vaginal, vaginal sanity, or which when we talk about the hygiene thing, we know for a bacterial manifestation, for a fungal manifestation, what you really need is a lot of moisture. तो यहाँ पे आपने देखा होगा कि you already have a lot of moisture here, which this gel can't hold more. Apart from it, what you really need for bacterial manifestation is lack of air. So when you see this plastic, it doesn't have even a single perforation onto it. So as a result, what happens with the female? They end up getting all those problems. Another thing that I would like to add with dioxin, many cases are coming to us nowadays to gynecologists, where female says that are facing challenges with conceiving. Yes, of course, I do realize the lifestyle have changed. You have a lot of stress factor in place, which is leading to those kind of problem. But to a larger extent, these pads are also a reason to it. When you are onto a chemical-based pad where you have dioxin, when you have plastic and all, your actually, potency is being compromised. You are more, you lack that potency which leads you to getting into pregnancy. So this is another challenge that we're facing with this pad. And then you have cyst which is in place, you have cancers which could be developed through this, and many more reason to avoid this pad. Now what is the alternate? हमने समस्या तो देख ली, what is the solution? Now I get into, I'm keeping this as a reference, this gel as a reference, so that we can contrast with the organic pad which we are going to highlight. So I'm just keeping it aside and taking up the organic pad. When we talk about the organic pad, यहाँ पे हमने 50 ml दिया, and we have seen that not even a single drop of water is coming out. So you can see the tissue paper with the full weight. Now I will just open up this pad for you, and here you have 8 different layers. So quickly opening this closely sealed pad, we have 8 different layers. I have taken out the first layer here. When we talk about the first layer, this is the first layer, a very breathable cotton skin friendly material. This is made of cotton and little bit of a silk to give it a firm texture. If I really have to tear it off, you will find it is so dry. While I tear it off, you have that threads coming out in the air. So this is completely dry, and this is an organic material which disintegrates while you put it in the land. Second thing that we are getting out of this particular thing is a antibacterial anion chip. The role of anion chip is to create a environment where the bacteria can't breed. मतलब अगर आपने एंटीबैक्टीरियल चिप लगाया तो आपको पता है कि वहाँ नमी नहीं होगी, वहाँ पे कोई प्रॉब्लम नहीं आएगा, इन्फेक्शन भी नहीं होगा. So this makes it more likely to use it for continued hours. So this is another thing which we got in place. Now if I take the internal content where we have the gel, so you have multiple layers and a pouch like this where the entire gel remains. Most of the females, while we sleep and while we go off to the bed, we know that there is a high chance of getting stained, because ज़्यादातर commercial brands में आपके जो blood होते हैं वो pressure पे या दबाव पड़ने पे side से leakage हो जाते हैं. The pads can't hold more than 20-25 ml of fluid. But here in this scenario, I would like to show you even after 50 ml, and if I'm pressing it hard like this, nothing comes out, and you will find it amazing when you see me opening this layer. So as quickly I open this layer, and you will find the gel, the total gel being in place here. So I'm just extracting the gel, and you have the multiple layers here. Now I would like to take your attention to the layers. So you have multiple layer here, everything is cotton, a very sterile cotton, probably the cotton that you get to see a doctor using in the surgical cases for the dressing, or sometimes in the parlors or the spa center when you go for facial, the face towels, the cotton soft towels, they're the same material. And of course, I want to highlight that all these layers are breathable because you have perforation onto it, which allows oxygen to penetrate deep and supplies oxygen to deep down to your vulval area, so it will remain dry for you. And when we talk about the moisture, so let us see the moisture part. I'm extracting the gel here quickly. Already 50 ml of water I have poured into it, and I told even if I consider a maximum of the flow, female would get into somewhat 80 ml of a flow. Here I have taken another glass with the fluid filled in, colored fluid filled in. So if you consider this glass, it is almost like, 150 ml of fluid which I have taken in place. The glass is been of 300 ml. What I am doing quickly is just pouring in this gel into it. So I'm just pouring in this gel into it and keeping it aside, giving it just a minute of time to show its absorption. Meanwhile, I would like to show you the last layer. This is very crucial. हमने वहाँ plastic दिखाया था, and we talked about that plastic causes you all these problems of skin. So I'm just taking this layer quickly. Now, when we talk about this layer, you will find this layer is called as release paper. So when we tear it off, you have simple paper which you can tear it off like this. Now the name itself, indicates that release paper let you release the heat that you exhibit out of your menstrual blood. So this is all in all total of 8 layers. And now coming back to the absorption. Thank you for being so patient and watching the entire demo. It is of course little time consuming, but I do appreciate that you have been throughout. So coming to the Ekta ji, coming to the absorption part. Each of the pad is capable of soaking almost 200 plus liquid. So you see the magic, 50 ml in place and the 150. And I have rightly said that we do not expect 80 ml and beyond. Of course, the blood will be more viscous and thick, so it will not spread like water that we are showing. So only conclusion that I can draw, if a female have been using 4 to 5, any commercial brand, may it be whatever brand you call, of the sanitary pad that is available in the market, here one organic pad is sufficient to give you the same result. Yes, of course that thing come in place where we consider कि डॉक्टर ने तो बोला था 4-5 घंटे में पैड बदलना, that is a very I would say that is a concept that gynecologists would have taken a decade altogether to make people understand why we do ask that. But yes, the whole point there was that those pads are made of plastic. So plastic ke sath, when you have heat and when you have enough moisture, you are more likely to develop a bacterial infection. Plus, in all those commercial pads that we have been using, you never have an antibacterial thing which we got in place for this particular pad. So here we have got a chip which is an anion chip which is being experimented and brought in place by a Japanese scientist for almost 10 years of research. So you have a lot of factors which goes into. So here, even if you continue using a pad for much more longer time, for almost a time of 12 hours, it is safe, it will not. But yes, we do say if your pocket supports and if you are capable of changing, yes, why not just change it for a mere sake of giving that satisfaction to your mind that you're changing and you do not have. But trust me, even after 12 years or 12 hours of uses, you don't end up staining, because no material will never bleed like this. If I really have to do a contrast, I would like to show you the kind of gel that we got out here. So I'm just taking out this gel here. I hope this is visible to you here. So
Yes,
this is the
please.
gel that we got from the organic pad Aries in a single pad, and this is what we got from the commercial brand where we highlighted this much. So if I really compare these two, each pad is worthy of almost 4 to 5 pads that you have used. But it is not only about absorption, it is also about excluding the plastic uses. It is also about eliminating the deadly dioxin chemical from your pad. It is also about the highest absorption, the breathe free material, the skin friendly thing. And more importantly, it is also about not contaminating the environment, because at the end of the day, once you're done with your periods, end up throwing, you and me, everybody ends up throwing the pad, and we never know where it goes, how the disintegration happens. All the plastic pads doesn't dissolve even after 5 to 600 years. The plastic do not disintegrates until unless you put certain processes into it. But when we talk about the organic pad, yes, it takes couple of months, but for Aries, it is almost 4 to 5 months that it completely disintegrates. And that is what we take pride of, that we are being responsible not only for ourselves, not only preventing our health, but also the mother earth. So this is one switch towards a sustainable solution. And yes, like Ekta ji initially asked about the various type of pads, one thing which have lately happened, the girls have been educated and they know the importance of hygiene. They really wanted to switch to something sustainable because they want to support the nature, and plus they also wanted some good solution for themselves. So many a female used to ask us कि menstrual cup में shift कर जाए. But here I would say this is one interim, solution in between pad and a menstrual cup. So you have an absorption as good as a menstrual cup here, and you are also switching to sustainable pad. So if you have any hitch in, switching to other option, this is definitely a good try. And with this, we have got one small thing that I want to highlight. Since we are on a mission of, preventing female from cervix cancer, each of this pad comes with a very quick thing like a testing kit. So if a female is facing any white discharge issue, she can actually take the white discharge from her private part, put it into this litmus card, wait for just 30 seconds or maximum a minute, and then they have the result onto hand, like just like the prega news kit यहाँ पे white discharge से करना है. And what we are trying to find out is the kind of the infection that you have developed. So you have a testing kit reader. So here it shows you whether the infection is mild, moderate, severe. If it is a mild, moderate, it is okay, we can handle it very well. But if it is a severe, only thing is we are asking you to go to your doctor as soon as possible, because it might be some kind of infection like a fungal infection which you could infect your partner, but it could also be indicated of developing a cyst जिसको हम रसोली कहते हैं, या it could also be indicated that you are more susceptible to develop a cancer in the later stage of your life. So this is a whole concept that we are preaching in, and I guess now the clarity between कौन सा pad इस्तेमाल करें कौन सा नहीं, I guess that would have actually been into your mind. So over to you, Ekta ji, on this.
My God, that's quite an eye opener, I think, for a lot of us that, what are we using and how we are harming ourselves and how we are also harming the environment. And like I always say, that, and as I mentioned in the beginning also, that when you talk about menstrual hygiene, when you talk about the sanitary pad drive and everything, it's not just that. There is so much which comes along with it. Before I go further, there is a comment that has come. Let me just read that comment. Oh, this is from Swati Mishra. We become thoughtful about these issues but hardly adopt them in daily lives. We become aware about many other environment friendly issues, but still we women are lacking on. Right, Swati. But I think, as they say, that it begins from us. We can't keep waiting for a change to happen. We have to bring in that change ourselves. So if we become conscious and, we kind of work towards creating that awareness for the others, like how we have made this attempt with Dr. Kanchan to talk about this, how Kanchan is trying to do this with the, on the platform of WICCI and in her individual capacity also. So I think today has definitely been an eye opener for a lot of us, that what are we using, what are we consuming, and how are we jeopardizing our health, jeopardizing our environment, and what are we really leaving behind, for the future generations to come. So I think we need to be conscious about these things. That's one part of it. And I'm sure after the demo that one has seen, one would really, I mean, I'm definitely going to check this out, that what is the napkin that I'm using, what is it made of, does it really have that kind of absorption capability, does it actually, is it friendly on the body or not, which I'm sure each of us knows the answer to that. But it is time that we really think about this. There's another comment that has come, which is, myself thinking since long time about to change this. Now as I got bunch of amazing information, will definitely adopt. Wonderful. So Swati and all the other viewers who are watching this, the intent of this conversation today with Dr. Kanchan Singh is not just to just show you the demo, but for you all to really think that how you can move to a more sustainable option. Because menstrual cups, as Dr. Kanchan mentioned, that in our society we may not be introducing this to the young girls who are unmarried. Anything which is invasive is not, something that is being propagated for various reasons. I'm not going to get there. But if we all are being conscious about our health, about the environment, then we need to bring in that change. That is one. In order to bring in that change, we need to talk about these things, we need to create awareness. And Dr. Kanchan is on this mission of creating awareness, and she is also looking for collaborating partners for and by collaborating partners I mean who can support her in creating this awareness to many and more women in different cities in different regions across stratas, so that more and more people are aware about these products. um, if you have any questions with regards to the product that Dr. Kanchan has shared, firstly, let me put a clause here. We are not promoting any product over here. Our intent was purely to talk about, and share the information. Having said that, should you need to know more about the organic sanitary napkins, please feel free to connect with Dr. Kanchan on this. If you wish to be a collaborating partner with her in terms of creating awareness or about the particular said product, you may definitely get in touch with her. And yes, I think that's the next thing that had come to my mind. Thank you, Ranjana ji, for bringing this up. That was my next thing that I was about to ask Kanchan. So Ranjana ji is saying that I was watching the session with my maid. She was worried about the cost and availability. So Kanchan, that is something that you
Yes.
need to address.
Yes. Definitely a very valid question, and thank you, Rachna ji, for bringing it in place because it actually was off my mind. Yes, the cost is a very important factor to consider whenever you switch to a different brand. So, if I consider any market available brand right now, each of the sanitary pad is almost costing in a range of, you have varied qualities onto it. But a basic quality, even if I consider something around 8 rupees to 10 rupees for a single pad, so may it be your brand, you know that it costs you 8 to 10 rupees a day, and for a single pad, and you end up changing 3 to 4 pads in a day. So अगर आप दो change करते हो, it costs you 20, अगर आप तीन करते हो 30, and चार करते हो 40. So if we consider the costing for example, the brand that I exhibited here, each single pad is costing you 20 rupees, and it is वर्थ ऑफ, अगर आप एक पैड यूज करते हो, यू डोंट नीड टू चेंज इट, ऑलमोस्ट 4 पैड की कॉस्टिंग आप सेव करते हो. सो इफ यू आर एंडिंग अप विद चेंजिंग 3 to 4 times and spending 30 to 40 rupees, this is very much, easy option for you to switch to organic brand with just 20 rupees a day. And yes, we do not charge anything for the for the testing kit. So this comes complimentary within the pack. ये अलग से कहीं भी मार्केट में सेल नहीं होता है. The whole idea to tell the female is, it is just not about checking onto the infection, but also switching into the right set of product where you don't end up with the infection yet another in the next month. So the whole thing comes in 20 rupees a day for a female.
And how what is the quantity in one packet?
So in each pack, those commercial packs are like this. In each pack, you have 8 different packs. So we have different sizes. So if it is a smaller size, in the same price, you have 10 packs. So it would cost you around something around 17 rupees a day. When the sizes are for the school girls, the usual size that we all of us will be using it, the extra large one, which is almost 280 mm. So that costs you 20 rupees a day with with the testing kit free. And we also have the very large pads which are 350 mm, which could be utilized with a female who want extra, extended one, or sometimes even for the maternity, post delivery things. So the entire material and everything remains same, just the size varies. And apart from that, we also have come up with a very unique thing which are called specific panty liners. So all those female who are facing the white discharge problems and all, you have a small, panty liners which is just 155 mm, small thing. But every day, once you put once in your panty, you are well assured that you do not have further chances of developing a urinary tract infection or a reproductive tract infection. So you आपको बहुत help करता है in terms of regularizing your period, and also it helps you to correct the white discharge. So this is a magical product, I must say, that one have to use to actually experience the thing. And yes, Ekta ji, just a last piece of information, because the viewer have been so long with us and have been very kind. For all the females who have been commenting and thinking about the switch, I would only say we had two purpose to come here on behalf of WICCI. One is, of course, we really want to encourage incorporate the sustainable switch for all of you, so that even a single switch आप एक इंसान भी यहाँ बदलता है, तो that is a help to the society and to the mother earth. So we really intend to make you switch to a sustainable resources. But meanwhile, on behalf of Vicky and on my personal behalf, I want to ask for volunteers who can come forward for a socio commercial project. Yes, definitely we are in a mode of encouraging more awareness into the society, but we want to recruit more of a consultant who can come forward. All those brave ladies, who really wanted to make difference to the society, who really wanted to bring in an extra source of income for them while educating the society, we welcome them. So I will drop a link on this video of my page or my credentials, email id. If any one of you think कि मैं भी ये चीज़ किसी को बताना चाहूँगी और मैं भी 4 फीमेल्स को उनकी जान बचाने में मदद करना चाहूँगी, we would be more happy to have you as a team here. And we are operating pan India, so any state, any city are more than welcome. And it is, you can operate anywhere. Yes.
Absolutely. So you have Swati Mishra saying that she will connect with you and definitely go for the product too. So we definitely have been able to create that one change. So Swati, I will share Dr. Kanchan's number with you, and you guys can talk to each other. Should
Immediately.
anybody else want to connect with her, please feel free to connect with me. And of course, Kanchan is going to share all her details. But anybody needs any information, you can get in touch with me. And go for it, make a difference. And as our chief happiness officer Ela always says, each one each one. तो अगर हम सब मिल के एक दूसरे का साथ देंगे और एक दूसरे की हेल्थ पे ध्यान देंगे, I'm sure it's worth the penny that you spend for your own health, for your own well-being, and for your daughters also. Yes, she does have a YouTube channel. Dhirendra Singh ji is asking, do you have a YouTube channel? Would you want to mention the name of your channel?
Yeah, so my I have a YouTube channel, and I'm very glad within a span of 10 months we have actually reached out to 2.5 lakh viewers on the same topic. So it is buzzing in all through the YouTube. The channel name is, in fact, on my name itself, Dr. Kanchan Singh, and I will drop a link for all of you to visit the page onto this video once it is uploaded on Facebook and
Absolutely.
YouTube.
Absolutely. So now Dr. Kanchan is also a member at Motherhood Club. So I'm sure, she would be on a regular basis sharing a
Yes,
lot of
definitely.
information with us about our hygiene, about menstrual hygiene. So thank you, Dr. Kanchan, for demonstrating it live here, for sharing all the information that you've had with us. And I'm sure it will definitely make a difference. We will connect with
Definitely.
you to see how we can take this forward. And
Sure.
all the members, feel free to connect with her or connect with me should you be keen to create this awareness, make a difference to self and all the others around you. So
Sure.
this
Thank
was
you so
our
much, all the viewers, and a big, big gratitude to Ekta ji for taking that initiative. I'm immensely thankful to the entire member, all the people who are associated with Motherhood Club. And as the name suggests, the motherhood, everything, the intent goes towards, saving that mother. Either it's a female as a mother or it's the mother earth as a mother, the earth as a mother. So I'm very glad to be associated. And Ekta ji, this is just one of the session. I would look forward to interacting on individual basis through the Motherhood Club Facebook page only. So I actually request everybody to stay connected and let us know, both of us, if there is any opportunity to reach out to your cities and expand this awareness program. Thank you so much.
Absolutely, absolutely, and I will second what Kanchan said, that we should do that. We should be, supporting all the women while we are reaching out to the humble background women. But trust me, there are many women like you and me also who are still not aware about the hygiene issues. We've talked about this in even in our cancer awareness sessions, that why it is important for all of us to do our breast examination, go through the pap smear test, or do the preventive test on a regular basis. Not just for women, even for men. We're talking about the PSA test, the PSA antigen test for men for prostate cancer. Regular checkups is a must. So please don't take this lightly. This is your health. Your health determines the health of your family, and the health of the family determines the health of our country. And we just all perhaps gave our commitment to the nation yesterday on the 75th, or the 75 years of completion, and the 76th Independence Day. So I'm sure this much we owe to ourselves, this much we owe to our planet, and to all the women of our country, of the world. So, thank you everyone for joining in and sharing your thoughts, asking your questions. We will surely share the details of Dr. Kanchan over here. and she would be also actively sharing information with all of us on the group so that we are more aware, and if we are aware, we'll be able to take the right decision. So thank you, everyone. Signing off for today, but we'll be connecting with all of you on the 18th of August 2022 at 6 p.m., where we will be bringing out a journey which is very different, unheard of perhaps. What it is, I am not going to spell the beans because I want you all to join us if you wish to know the journey of this individual, which is full of emotions, roller coaster ride, and a lot more. So see you all on 18th of August 2022 at 6 p.m. only at Motherhood Club. Till then, stay safe, take care, मास्क पहने रखिए, केसेस बढ़ रहे हैं और मंकी पॉक्स भी है, हैंड फुट एंड माउथ डिजीज भी चल रहा है, बहुत कुछ चल रहा है. सो अपनी स्वास्थ्य का ध्यान रखिए और कम जाइए बाहर, यहाँ आइए, हमारे टॉक शो सुनिए. किसी अगर कोई आप में से अपनी जर्नी शेयर करना चाहता है, कुछ information share karna chahta hai, please feel free to connect with the team, or you can email us at motherhoodclub2020@gmail.com. Till then, stay safe, take care, bye bye, and thank you once again, Dr. Kanchan, for being
Thank you so
here.
much.
It was indeed a pleasure to host you.
Thank you so much, everyone.
Bye bye.